over the standing therapeutic exercises. So Christine will be my model. She's an occupational therapist here. We'll begin with, before we start, I just want to mention that it's always good to have something sturdy to hold on to, so we recommend you use something like a kitchen countertop or a bathroom countertop. You want to make, or a sturdy table, like so. You want to stay away from holding onto chairs and things that might not be as stable. Also, we recommend that maybe having a chair close by, that if you get tired, you can always sit and rest after doing the exercises. So we're going to start with active ankle dorsiflexion. So holding onto the table like Christine's holding, you're going to get up onto your toes, hold for a count of 5, and then come back down, and rock back onto your heels and hold for another count of 5. We're going to repeat that 10 times. So you want to make sure your posture is good, so standing up tall, make sure you keep holding on to the sturdy countertop. And remember your breathing, so remember not to hold your breath. So you want to exhale as you're exerting yourself, and take a breath in while you're relaxing. How do you feel?
Okay, I think I'm at 6. 8.
So this exercise is working the calf muscles and also the muscles in front of your shin, your anterior tibialis.
10.
Okay, good. The next exercise we're going to be talking about is active knee flexion. So standing at the countertop, you want to bend your knee and hold for 5 seconds. And then down.
Do I alternate with these?
No, let's do 10 on the right first, and then we'll do 10 on the left. Good question. So this exercise is strengthening the hamstrings, and it's also strengthening all the hip stabilizers, knee stabilizers on the opposite leg while we're doing it.
5. 6. 7.
Also, you want to maintain good posture so that you're not leaning to one side more than another and not compensating. So really just the knee bending. The hip is not moving.
Switching
This section.
legs.
Good. And to make this harder, you can add a weight, or you can do 2 sets rather than 1. Very good, Christine.
Thank you.
You must have been practicing.
4.
If any of these exercises cause you pain, I would recommend that you stop and don't do them. And if they continue to, either go to the doctor and see what's going on, or ask your therapist.
9. And 10.
Good. Very good. The next exercise we'll be going over is hip flexion. So active hip flexion. So what you'll be doing is you'll have to turn. So face the camera. So you're only holding on one side. If you feel like your balance isn't good with this, you can either hold on to a cane in the other hand, or if you have someone at home that can hold on to your hands to help stabilize, you can do that. At Burke, when you were doing the exercises, you were in the parallel bars doing these. So you had support on both sides. So if your balance is good enough, you can do it by holding on with one hand, or you can have someone else hold on to your other hand, so you'll have 2 bases of support. So what you'll do is you're just going to bring your legs straight out and hold for 5 seconds. So if Christine needed help with her balance, she could have someone holding on to her on this side, or she can hold on to a cane or another sturdy surface. So this exercise is strengthening the hip flexors. You want the knee to be straight, and just the only motion that's occurring is at the hip, so you don't want to see any compensation in the trunk.
That's 10.
Try to hold it for a little longer, Christine.
2.
Okay. So you should be feeling it in this area here when you're doing the exercise, and down into the quads too, down towards the knee.
Okay.
Okay, good. Okay, so the next exercise we'll be doing is hip abduction. So you can hold on with both hands. Just make sure you're holding on to something sturdy, away from any objects that you might hit, and you're going to be bringing your leg out straight out to the side, holding it for about 5 seconds, and coming back down. So So repeat that 10 times. One of the things that people tend to do is sway to the opposite side when they're doing it. So you want to make sure that your posture, that you're not swaying, so that your shoulders are pretty steady and just the leg, you'll feel it in the glute muscles. So over here on like your back side and down the side of your leg. As with all these exercises, if you want to make it more difficult, you can add weights or you can add sets.
Okay, that's that leg.
Okay, so let's switch sides. Three, 4, 5, 6, 7, 8, 9, 10. Good. Okay, the next exercise we'll be talking about is hip extension. So you'll be holding onto the table and bringing your leg straight back. So keeping your knees straight and holding. Just like that. So make sure you're not swaying forward too much and just kind of moving at the hip joint. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. We'll do 10 on the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. The next exercise we're doing is also hip flexion, so it'll kind of be like the other exercise, except this is more of like a march. So you'll be holding on. With this one, you can either hold on to the table, but you just have to be careful that your knees don't hit the table. So it'll probably be better if you just hold on with one hand and either have support on the other side from someone, or if your balance is good enough, you can do it without holding on the other hand. So you're just going to bring your leg up, hold, and then come down. So you can alternate with this one. So it'll be like a march. So that's 1, 2, 3, 4.
I'm doing so well, I don't need support.
Yeah. And with this one too, you can have ankle weights on to make them a little more difficult.
6, 7, 8, 9,
10. Good. Very good. The next exercise is going to be knee extension. So what you're going to be doing is holding onto the table, and you're going to be bending down halfway at your knees, and then coming back down. So these are like mini squats. We call them mini squats. So it's almost like you're sitting down into a chair. You're pretending you're sitting down into a chair. And you want to make sure your back is fairly straight. And just make sure you don't go down too low, because if you go down too low and you might have difficulty getting back up. So just about halfway down, or less than halfway down to the floor. You can hold this one for 5 to 10 counts as well to make it a little more difficult.
And you shouldn't forget your breathing, right?
And don't forget your breathing. Exactly.
That was 10. So when would you exhale? On the way down?
Yes, I would exhale on the way down, and then you can hold for 5 to 10 counts as you come down, or once you get down.
6, 7,
You want to make sure your posture is good.
8, 9, and 10.
Good. So that's the end of the standing therapeutic exercises. So that wraps up the standing and seated exercises. Remember your breathing, remember to exhale on exertion, and also to increase these as you get better at them. So start out by doing them once per day, and as you get stronger, you can increase to 2 or 3 times per day. Thanks for watching, and stay tuned for the next part of the video.